Thank you to everyone for joining us this morning. This webinar goes from 9:30 until 10:30. We'll leave about 20 minutes at the end of the presentation for your questions. Feel free to post questions in the chat throughout the webinar though, and we'll address them as we go. This morning, we're joined by Dr. Merv Gilbert. He's joining us from Vancouver this morning. Merv, would you be able to introduce yourself?
Sure. Thanks very much. Pleasure to be here. Good to be working with Diversified again. Hi, Derek. I'm a variety of things. I've had about 30 years experience as a clinical psychologist, as both line worker and manager. And for about the last decade, I've been working as a researcher and consultant, primarily in the area of psychologically healthy workplaces, how to do proper assessment, how to move forward, how to evaluate results. And I will say it's the most exciting aspect of psychology that I've ever been involved in.
Awesome. Thanks, Merv. And we're also joined by Derek Sienko, who is the CEO of Diversified Rehabilitation Group. If you could say a little bit about yourself, Derek.
Yes, I have over 20 years experience in the return to work, disability management, and aspects of mental health at work, as well as physical aspect of assisting employees with return to work. As an organization, we help employers and individuals in making return to work successful. My background, I used to be an injured worker, worked for the WCB of my greatest life assurance company, and now I'm the CEO of Diversified Rehabilitation Group. Thanks, Merv, for joining us today. Always pleasure working with you, and let's tackle that psychological aspect of return to work today and help others to become more fluent with.
Awesome. So there is a list of questions that we'll be going through, and then these questions will be posted. Well, we can send these to you at the end of the presentation as well. Okay, so going to our first question, and I think a lot of us we understand the need for psychological health and safety, but a lot of the problems people have is knowing where to start. So Merv, can you tell us a little bit about where someone can start in tackling workplace mental health issues?
Sure. Now, I'm presuming we're taking the perspective of an employer in that sense. Where can employers start in addressing workplace mental health issues? Well, a couple of general comments. First of all, I think it's the responsibility of both employers and employees to create the environment in which they want to work. So I think there's a shared responsibility there. Secondly, I'm gonna start out by diverging a little bit from using a phraseology around mental health in particular. I think a better word, and that's the title of this seminar, this webinar, is psychological health, and more specifically, psychological health and safety. Unfortunately, when we use the word mental health, we actually end up meaning, in most cases, mental illness. And when we use words like mental illness, the mind automatically goes to psychiatric diagnoses, including serious and persistent disorders such as schizophrenia, bipolar disorder, and like. Those are obviously very important issues for society and for the individuals and families involved, but they are not the issues that involve workplaces. When we talk about psychological health, we're talking about the whole spectrum of human experience, frankly. Not everyone has a quote-unquote clinical depression, but everyone experiences sadness. Not everyone experiences an anxiety disorder, but everyone experiences worry at varying degrees. So I think the language that even there, that change in language to psychological health and safety is really critical, and that's reflected actually in the National Standard for Psychological Health and Safety in the Workplace, which has been around since about 2013, and frankly is probably a good place to start. If organizations or employers are not aware of the standard, it's worth checking it out. It basically provides a psychological health and safety management system, sort of some of the key components or elements that should be in place to have a psychologically healthy workplace. That includes, and I'll run through those, that includes a sense of leadership commitment, active involvement by all employees, a proper planning process where you're identifying your risks and opportunities, a determination of where your particular needs are, and developing interventions that respond to those particular needs, evaluating what works and what doesn't, and then keeping continuous improvement. So I'll stop there. I think it's a big task. It's not a quick fix. It takes time and it takes culture change.
Thank you, Merv. So from an employer's perspective, that Sounds like a good plan, but what can people do on the individual level? How to start maybe changing their perspective on mental health?
Well, again, I'll talk psychological health in that sense as well, but get informed. There's more and more information out there from various sources. As I said, the Mental Health Commission of Canada has a whole bunch of material there. Diversified has material. Our company, my consulting firm, Psych Health and Safety, Vancouver Psych Health and Safety Consulting, we have a whole bunch of reports and tools there. Get informed. Find out what's available. Talk to your colleagues, talk to other organizations, particularly in a certain sector, and find out what they're doing and what they're not doing. And also, and I'll throw in a bit of a plug here, and it's a nice plug for Diversified. One thing that I'm involved in, I'm the chair of the Psychologically Healthy Workplace Collaborative within the Psychology Association. Diversified was a recent winner. And that's a nice resource for information about psychologically healthy workplaces.
Derek, do you have any opinions on how, from the return to work perspective, how employers can support mental health issues in the workplace?
From the return to work perspective, the sooner you start, the better. Step number one, I strongly encourage employers always to check what they already have in place and make people aware what services or support employees have available to themselves, whether it's employee and family assistance program, and really understanding what that support is all about, and also making psychologically healthy workplace part of your culture. Even though we spent the past couple of years talking a lot about that, for many employers, this is still a taboo topic. People don't know how to approach that, don't know how to, whether it's from the management perspective or from the employee's perspective, how to approach that issue. One of the things that you can do is just open a forum, have a discussion, have your employees involved in talking about psychologically healthy work. As an employer, sometimes you may find this challenging. So it's probably a good idea to invite a third party to come and do a presentation or a workshop for both management and employees, normalizing psychologically healthy workplace and making this as a part of your culture so everybody understands common responsibility and that they do not have to shy away from talking about it. Initially, it's going to be, so to say, awkward, but the more you talk about it, the more you strategize around that, the better off as an organization you're going to be at the end.
Okay, so moving on to the next question, which is more of a specific question. So looking at question number 2, and this is a common thing that we find maybe in some positions more than others, that if your employees are showing signs of burnout, what can an employer do to support them? And maybe what can coworkers do to support someone they might think is showing burnout?
Shall I start?
Yep.
Sure. Okay. A couple things. And I need to throw in this proviso for all my comments. Please appreciate that I'm speaking in general terms as a consultant. I'm not providing any kind of clinical or professional advice. That would be unprofessional and unethical. So my response, and I think Derek as well, have to be sort of in a general sense. If someone is suffering to some degree, we certainly would encourage them to seek the appropriate professional help. Interesting question, because burnout is sort of a common term, and all of us have some understanding of that. Burnout, however, is not thankfully, frankly, a psychiatric diagnosis. So burnout is a sort of a behavioral sense of cynicism, not making a difference and so on, kind of detachment from the work. The responsibility of the employer, and I'll say this in response to some of the other questions as well, is with respect to behavior at work. So your job as an employer is to supportively support the performance of your staff, not to comment or find out about their mental health per se. So that's really critical. Now, that said, that doesn't mean you can't be and shouldn't be a compassionate human being, concerned. You may have a relationship with employees in the sense that someone really is struggling. That doesn't preclude that kind of conversation. And that applies to coworkers as well. As a fellow coworker, if you're worried about someone, talk to them. Point out the behaviors, be fairly specific. I have noticed in the last while X, Y, or Z. Are you okay? Is there something I can do to support you? So keeping it that level.
Derek, can you add about burnout?
Well, one of the major things when you and spot this, and that may appear in many different ways. You may walk into an employee's office, a clerical position or administrative. Some people will sticky up their office with different stickies trying to organize themselves. So some of those signs appear in many different ways, whether they are doing office job or physical job. But one thing I can suggest, get an employee engaged in this process. Don't try to solve an issue for them. Ask and open a forum, clarify for an employee that you are there to assist them, but you cannot do this without them because they are the one who knows the job the best. And do not anticipate an immediate answer. You need to tell an employee that you are there to support them, that you would like them to think about it, come back to you so they can give you some ideas how they can make that happen. Listen to what their suggestions are, and make sure that when you're having that conversation with an employee, that you reassure them that you don't want to know from the perspective of medical side what is going on with them. You just want to be there and support them in that journey. Getting a coworker involved may or may not be a good idea initially, but definitely working with an employee and helping them to understand where they are at and how they can strategize for themselves, and then you being as a support in helping them to make that happen is a good way of addressing that. Now, whatever you do in this regard, please make sure you put this in writing. So you don't need to write an essay on that. What you need to do is just formalize this in a bullet format, and then put an action plan around that from the perspective of what is going to be happening, when it's going to be happening, and how you're going to be supporting this employee with their input. But once again, make sure that the employees engage in the journey of helping them to overcome that struggle. And of course, if there's additional support that you can bring to an employee's attention, which is employee and family wellness program or assistance program, whatever you have available to them as an employer, that would be a good idea to bring this to the employee's attention as well.
Thank you, Derek and Merv, for your comments on that. Looking kind of, if you're going off of burnout, sometimes when burnout becomes too much, then people leave on a stress leave. Someone asked a question, I have an employee returning after stress leave. Maybe some of the coworkers are a little skeptical of them coming back. How can you accommodate to someone who's returning from a stress leave and making sure that they're going to be in an environment that supports their mental health?
Good question. Let's start by saying there's no such thing as stress leave. Stress is not a disorder. So if we're talking about long-term disability, recognized LTD in that sense, or as short-term disability to some extent, that will usually require a diagnosis, and stress is not a diagnosis. So even there's the language. Often if someone is off work with a quote-unquote mental health condition and so on, that will usually be something like there will be a doctor's note talking about depression or anxiety in most cases. The semantics there, the language is really, really, really important, because suddenly when we use words like depression, anxiety, we're saying it's a disorder within the individual, whereas stress is the interaction between the individual and the environment, and may in some ways be more appropriate. So let me see if I can address the issue, because there's a number of components. First of all, I would echo what Derek was saying in general. Good return to work practice is important. Earlier is certainly better than later. If there are unresolved issues when the person went off work, do what one can to deal with those issues. Don't set the person up by coming back into a situation where there's going to be significant tension and problems. Have a very meaningful conversation, and this may be you or maybe some external person handling their return to work. Have a very meaningful conversation about what that person would like, how they would like to handle the return to work. What is going to be important to them, what's going to be challenging. People are going to say, we noticed you were off work. Why were you off work? How does the person want to respond to that? It's their own personal business. They may choose to say, I had some health issues I need to deal with. That may be it. They may wish to disclose more. But they need to prepare themselves for that conversation that occurs. You need to have doing some, well, actually, I recommend against this one. Some organization who said, great, we're going to run a mental health awareness program prior to this person returning. I do not think that's a good idea at all. I think it's a bad idea because it sets the person up. Everyone goes, oh, here's the guy coming back with the plague or whatever the case may be. It's actually, I think, can be very counterproductive in many ways. You need to have a bit of a relapse prevention plan. What a lot of return to work plans miss is dealing with the fact that things like depression can recur and so on, and a person may slip, as with any health condition. So having some plans in place where you talk about how you're going to deal with such things. Is it going to be a temporary reduction in responsibilities? There's some general ideas. I'll pass it over to Derek.
So my take, thanks, Merv. I really agree with what you were saying, 100% on that. Adding to your comments, I really think that from the return to work perspective and having an employee returning back to work and employees not looking to that, one thing that resonate with me. I don't remember when that was, but definitely came from U.S. Military. They never leave their own behind. So that's a powerful statement. So when you are as an employer, you have responsibility to look after your own people, and your team needs to understand that the person who's off work, it's one of your team members. So you need to help this individual to help back to work. So the very important component and very important issue that you have at stake here, it comes from the leadership. As a manager, you have to first recognize and make this as a part of your culture, that you never leave your own behind, and you're going to support them regardless where they are at in their journey of return to work. We do need to recognize that sometimes there's issues, whether relationship issues involved between coworkers or performance. Regardless of all of those issues, you need to go back to a drawing table and say, from the return to work perspective, I have an obligation and responsibility to my employee to help him to get back to work. And you need to make sure that your employees recognize that. Because tomorrow it might be one of those employees who is not really willing to support this individual to get back to work. Sure may go off work, and they would be in the same position. So you need to standardize this, make sure that you follow a clear process, that you are there to support employees, and that you structure this in a way that is supportive and get your labor force ready for it. I can share with you from our own experience. When obviously I have a number of employees, and sometimes people go off work due to different life situations. What we do is first we stay in touch with an employee, so we understand when employee is what is happening with an employee. Then we engage an employee in the return to work journey, and then we engage entire team from that specific department and the organization at large. We meet, we talk to them that so and so will be coming back. We put a plan together. When an employee comes back to work, we send them an email or contact them saying, we're happy to have you back. We already have a plan. We met, we talk. When it comes to employees, we do a card for an employee, welcome back. And we also talk to employees and employee who is coming back to work, that there's no obligation for them to share why they were off work, because there's a lot of fear behind that. And the same, we normalize this with their coworkers, that there's no need for them to ask why this person was off work. And if the employee who was off work has the tendency to explain him or herself, that they know how to answer that. And instead focusing on what took place, because there's a lot of frequently guilt attached to that, helping them to be successful at work, making them feel welcome.
Okay, so it sounds like kind of both your answers come back to just, if you have a culture that supports mental health in the workplace and supports psychological health, then seems like a situation like this can be handled more appropriately, whether it's them leaving or having to come back. And it has a lot to do with the stigma associated to what you call the reasons why people leave. Merv, you would probably have some more insight onto this. So how can, whether it's employees or human resources, or employers or human resources, how can they measure the mental health of their employees, and how can this if you're going to measure it, how can you use it appropriately?
Okay, and I'm going to be a contrarian again, and I'm going to say you can't and you shouldn't. It's not the role of the employer to measure employee mental health, just as it's their role to measure their physical health. That's personal and private information and so on. There are certainly a number of useful, to a point, measures of things like stress, burnout, which is mentioned, and so on. But again, I would use that with, well, frankly, I'd be very, very cautious about that, because if you ask those kind of questions, you have a ethical, if not legal, obligation to do something with it. That said, what you can measure, and there are more and more good measures out there, and I'll talk about one of them in a second, you can measure your workplace environment, the risks, hazards, and strength in your workplace environment. Some of the folks on the webinar today may be familiar with Guarding Minds at Work. Guarding Minds at Work is something that myself and colleagues developed some years ago and has had a lot of traction, a lot of pickup. Guarding Minds at Work is a free web-based tool to assess and address psychological health and safety risks in the workplace and evaluate what kind of things you're doing. So that's what I think is important for employers to do, is to pay attention to the workplace environment. In that sense, it's very much like occupational health and safety. In the sense, you do a proper risk assessment. WorkSafe BC does not currently require you to look at your psychosocial environment, although with Bill 13, the legislation around bullying and so on, increasingly they're sort of moving in that direction. So that is what employers should do and so on. And employee input on that, Guarding Minds at Work, is a survey that goes to employees, asking them, because they're the experts in what their workplace experience is, asking them about the workplace.
I definitely echo what Merv is saying. What I would like to add, and I will approach this from more probably employee and family wellness program, and I just want to make clarification. There's a big difference between an employee family and wellness program versus employee and family assistance program. For the audience point of clarification, most employee and family assistance programs are reactive in their nature. So what that means is they wait for an individual to come and address their concerns, whatever those concerns are, where employee and family wellness program approaches this before it takes place. But that's for another workshop. A tool that helps employers to measure employee wellness, health and wellness, that I really promote, and I believe it's a very effective tool when you put this forward to employees, is a health risk assessment. A health risk assessment is frequently utilized by many employee and family assistance providers in a very ineffective way. How it should be utilized is you do this health risk assessment of your entire labor force, and you get a statistical data from the third-party provider. Of course, not releasing any names that Joe Smith is suffering from some relationship issues, but you're just getting perspective, how percentage-wise what is really happening with your labor force. And then you design an intervention around that. And employee and family wellness programs, that's what they do. They design the intervention based on your specific company's needs, not the other way around. So once you have once you have those results, then you work with employee and family wellness provider to put that intervention forward, whether that would be lunch and learn, whether the communication to employees would be on those specific topics that are sensitive to employees. And that's the way to go about that from my perspective.
Okay. So going on to a question that probably a lot of people have thought about, and this is going to be question number 8. And it says, how can I encourage senior management's buy-in to address psychological health and safety?
Great question, and a very important one. I'm going to cite a little bit. I want to talk a little bit about some research we just completed, because I think it's important for this. Colleagues and I just finished a 3-year research project where we followed over 40 Canadian organizations as they implemented this national standard for psychological health and safety. And we evaluated them at various points, including asking them why they were implementing the standard. And the expectation, I think, of many was that they were going to be doing it to save money. And there is indeed an argument that if you are able to reduce your disability costs, your benefits costs, and so on, keep people at work, and so on, you will save money. And that's reasonable, though somewhat hard to prove. What we found, however, is that the organizations, at least that participated in this piece of work, the main reason that they participated were implementing the standard for a psychologically healthy workplace. Their main motivation was because it was two things really. One was practical, that if people are struggling or there's conflict and so on, it's not a productive work environment. It just makes good sense to create an environment where people can be their best. The other reason was frankly an ethical one. It's just the right thing to do, that I recognize there is a responsibility for the people at work in an environment, and you have responsibility, as we do, for ecologically for the climate and so on, to create an environment where people can be productive and healthy. The other reasons were financial was certainly there. There was also a matter of risk mitigation or to avoid legal costs, because a return to work or wrongful dismissal can be very, very expensive and complex and so on. The point being, in response to the question, is to be really, really to work with senior management and look at the data that is available, LTD data, absenteeism data, employee assistance program data, whatever data you've got, and point out some of the costs in an organization's thing, and also look at some of the quality. Are people leaving? What are our exit interviews telling you about people? Does your organization have a good reputation? Is your reputation being damaged by people bad-mouthing or speaking ill of your workplace and so on? So putting the business case, and I mean that in the broad sense, not just financial, together for the organization. And certainly I will say, without that senior management, meaningful commitment and so on, it is going to be hard to make changes.
So from my perspective, how can we encourage senior management? If you're a person who within an organization that sees that things are not working out in this specific area, and you want to get your senior management attention, sometimes it's not as easy, as you probably know yourself. And the first thing that these people sometimes listen to is the money talk. So that sometimes is a challenging aspect. How can you prove to them that this is an important matter and it will only help the organization? So that requires definitely an openness from the management to really senior management to realize that on your end, you need to bring the statistical data forward. So look at your absenteeism, look at your data, look at you're not tracking it. It'll be good time to start doing that. Look at your short-term or long-term disability loss days. Look at your contact your benefits provider and get your claim assessment ratio, so you understand where you're at with that, whether it's WorkSafe BC or long-term or short-term disability provider. If you have sick time in place, make sure you have data on that. I can only give you a perspective from examples where we work with employers who struggles with that. And sometimes it's good to go to your senior management. If you don't have that data, saying, listen, I'm suggesting a pilot project. This is what I'm seeing. We do not have any data to support that. But how about we run the pilot project and see if that works? You'll probably have a better buy-in from them if they know what that project is all about. It's a short lasting, and we can show the results. That probably would be your best bet to make that happen. From experience, when we work the one organizations that we work with, I can tell you, when you struggle with those issues as an employer, you can easily look for your return on investment from the point of implementation within the first year is about 35%. I know it's a strong number. If you have the right intervention in place, you will see that your absenteeism will go down, your productivity will go up, and your LTD or STD claims will decrease as well.
So just going off of that question, if we go to question 10, whether it's senior management that's being cynical about it or other employees, how can you deal with cynical or negative employees when you're trying to improve psychological health and safety?
Again, good question, tough questions, and I guess it depends what you're being cynical or negative about. If there's a sense of cynicism, negative about your various efforts, I think you need to deal with it head on. I mean, you need to include them, to get them involved in the process from the start. I think you need to hear what their concerns are. I do agree with what Derek was saying. I've seen too many organizations that have put, frankly, token efforts in place. They had an online link to a stress management program or some such thing. And employees will become cynical. Like we've tried that before, and it doesn't work. I think, and in this sense, I will speak a little bit from my clinical experience, particularly with kids. What I would often say to parents, just because some kind of an intervention didn't work at one point in time doesn't mean it won't work now. If you do it sensibly, if you're very clear about what your expectations are, what kind of outcomes you're looking for, and why it matters, I think you can overcome some of that cynicism. So I think, and I also think you need to take a, frankly, positive psychology approach, a strength-based approach. This isn't just about looking for problems or weaknesses. This is also about building up the strength and resilience of the individuals and the organization as a whole.
From my perspective, it's not an easy task. An example comes to mind when I attended forum, the conference where some of those issues were brought forward from an employee in a welding company saying, how do I convince my senior workers to follow occupational health and safety steps? From that employee's perspective, he was stating, well, I'm a new employee. There's about 4 of us, they're new. We have about 18 old senior guys, and their perception of occupational health and safety is way different than ours. You need to open a conversation with those individuals. Sometimes you need to find something that's common for those individuals or important to those individuals. In this specific situation, what that employee said says, listen, you know what? You have kids, you have grandchildren. They engage in a discussion. One of those senior workers who was definitely at a different perspective on occupational health and safety, he says, yes, I do. He says, would you like them to see you next time when you decide to go and visit them? The worker says, yeah, definitely. Why are you asking me those questions? He says, you know what? Because I would like to go and see my kids as well. And what we do here at work is actually not safe. I would like you to take a look at this, and maybe there's something that you can go do and change to have a safer work environment. It did change that individual's perspective, and he became more open to discuss those other components. Sometimes that's all it takes. Is there an easy answer to that? No, it isn't, but definitely embracing psychologically healthy workplace from the senior management perspective is the key. It has to come from the leadership, and then you need to spread that to your labor force. But it has to have an emotional connection. People need to understand why they are doing this. It cannot be another process that you're implementing as an organization to make that happen. People need to understand the importance behind it.
Last question I'd like to address is number 12, and it's, what tips do you have for assisting employees who aren't bullies in the legal sense, but who are insensitive to others in the workplace and hurt a lot of feelings? So maybe this goes off being cynical or negative about maybe what other people are struggling with. So what tips do you have, Merv?
Well, interesting question to some extent. And bully is one of those loaded terms. Bullying is, frankly, somewhere in the interaction between the person being bullied and the person who's bullied and so on. Bullying is in the eyes of the beholder to some degree. The legal definition isn't necessarily helpful, nor is necessarily castigating and blaming the quote-unquote bully. Some folks, managers or co-workers and so on, will lack the interpersonal social skills and so on to realize the impact of their behavior. So I think some direct feedback, if you are in a supervisory position for those individuals, to show some feedback. These are your behaviors, and this is the impact it's having on other people. It is being very direct. Don't talk about your attitude and so on. Be very specific about behaviors. When you do this, when you say this, when you yell at someone and so on, it is having this impact in their behavior. Letting them know that that behavior is not acceptable for a variety of different reasons and so on. And you do have an expectation that they will make efforts to improve it, and providing certain support, so that maybe through external counseling, psychologists, whatever the case may be, some kind of training and so on, to change their behavior, giving them an opportunity.
Well, it's never easy. I like to use case examples to address that. Sometimes you have to go through a difficult journey in order to address that. Case comes to mind where we were approached by an employer to address exactly that situation, and it actually was challenging work culture, because that was for first responders, and their culture is a little bit different from the perspective. You're expected to put up with some of the bullying. You are expected to, in a quotation, suck it up, buttercup, do it as I say, or you're not part of the team, because we are here to support each other. You're the new body on the block, follow, and with time you will get it well. So if that comes from senior management or leaders, or then it's spread to coworkers, you definitely have an issue on the table. So in that specific situation, HR had to get involved, and they did an investigation. Investigation included interviewing the person who reported that there was a bullying and harassment at work. They interview coworkers, they interview those leaders, and then they try to put a strategy in place to have both parties, those who were causing that bullying and harassment, as well as the individual who suffered that. So obviously, it's part of the culture to address this on the cultural level and try to change that. But these people are still together, working the same workplace. You try to overcome, provide support to them. And recognizing this from the HR perspective, what needs to take place, there's a next step. How do you help these people to overcome that emotional component? So my suggestion in this situation is to bring a qualified provider who can assist you in this journey in making that happen for this individual. Of course, from the HR perspective, if there's an opportunity to do some shovel from the perspective moving the individual from one location to the other to reduce the emotional pain and provide support, probably would be good to consider. But do remember, you need to take two parties into account: the one who are bullies and also the one who are victim of that. Unless they bullies don't recognize that they've done something wrong, and then you have a bigger HR issue. But if they do, you want to move forward, you need to provide support to both.
Okay. So I'd like to open it up to questions from our viewers now. If you have a question, please type it into the chat on the right-hand side of the screen, and then we'll address them. And then if not, then we can go back to some previous questions if Derek or Merv has something they'd like to add. So we did get a question that says, do you have any information on the healthcare version of guarding at work in terms of rollout and evaluation? Merv?
A very interesting question, and someone's plugged into that. I'm not going to give information on the webinar and so on, because it needs to come from the people involved in this. I will give the context that I think this is where this is coming from. Through our company, and so we are working with the Mental Health Commission of Canada, an outfit called Healthcare Can, to create, and it's not a version of Guarding Minds at Work, to create a number of instruments, number of tools, one of which is a survey that uses some of the lessons from Guarding Minds at Work to ask about the psychosocial work environment in healthcare. So we're creating that tool, and we're also creating a similar tool for organizations to use to recognize some relevant indicators for progress, as we've talked about. That's an ongoing project. It will continue for several months. We're about to launch our pilot across the country at a number of organizations and so on. Once we have the pilot of those tools and so on, we'll work on finalizing them. And I can't give an exact date, frankly, because it depends how well the pilot goes in participating organizations. I would anticipate that we would complete this part of it, at least create the draft tools in the summer. How they get disseminated beyond that is up to Mental Health Commission and the other players.
Okay, was there any more questions from our viewers? I'd also like to let everyone know that we recently partnered with Merv to write an article in the Business Examiner. This is a paper that goes out in the BC Interior. and all across BC actually. So the Business Examiner article is available. If you go to our blog or if you go to LinkedIn, you can see the Business Examiner article that we wrote with Merv, talking about a lot of the same things that we talked about in this webinar. It also gives you some information on where you can find more resources about this. So Merv talked about a lot of resources that are available through his company and through Guarding Minds at Work that we can definitely help set you up with if you're interested in those. Merv, was there anything you wanted to add to the end of the webinar?
Well, I'll go back to a couple of questions. I think there are some important things that were raised. One of the questions there has to do with working collaboratively with unions. With respect to accommodation, I'm going to put the accommodation piece aside for the moment and talk about working in unionized environments. I think that is a key issue because I think there can be an unspoken tension, perhaps, between employers and employees or workers and managers in some sense, that from the employee's perspective, what the employer is just doing this stuff to get more work out of employees, to stress them harder and harder. And there can be a skepticism towards things like Guarding Minds at Work survey tools and so on. It's saying you're just basically trying to lay all the blame on the worker. So this kind of blame the worker mentality. And I don't think that's accurate. On the flip side of things, there can be sort of an unspoken message from employers saying, what is this all about stress and mental health and so on? When I was a boy, we didn't talk about stress, et cetera, et cetera. We have raising a bunch of wimps, can people just suck it up? So that position, which unfortunately continues to exist in place, just isn't productive. I said at the outset, to move forward in this area, as in the general area of health and safety, it's a collaborative effort. And I think progress will be made when we recognize that there is collaboration here. One of the earlier questions about this national project I'm involved in part reflects what is going on in BC. The BC Nurses Union, in their last contract agreement, the agreement mandated all the health employers within the province of British Columbia to implement the national standard for psychological health and safety. So it's a pretty bold move on the part of the union. In this case, the union is saying we want to work together to improve the workplace. So I think that's a good example of that potential collaboration.
You definitely need to have the union at the table. Sometimes the journey depends what is your relationship with the union. But bringing them to the table and making that as a common goal is definitely something that I strongly encourage. From the perspective of the union, they may have a little bit different perception on the issues than you have with respect to psychologically healthy workplace. My suggestion would be find a common goal and then start from that. We worked with a number of employees who are heavily unionized, and we have unions who are more open, or the unions that are more open to bring this forward. So some suggestion what we had for union leaders is, hey, you can talk to that union, that we just make that happen for them. What is their perspective? And bringing them to the table and working on a plan how you envision making that happen is definitely the way to go. Sometimes that might be a journey that takes some time, but from my experience, once you formalize, once you know what that is, and once you establish an action plan and how we're going to make that happen, that increases your success.
Merv, was there any other questions you wanted to go back to?
Nope, that's pretty much it.
I would like to let you guys know as well that we do have a blog. Diversified, we write a blog a couple times a month, so you can follow along with that as well. We follow up on topics from our webinar, we talk about our next webinar, and we also talk about events that are going on. So feel free, you can access that from our website. That's a good resource for information on return to work, disability management, psychological health and safety, and a lot of other topics as well. So I'd like to say thank you to Merv for joining us today. I really enjoyed the discussion, and I hope our participants did as well. Thank you for Derek as well for joining us today. And I hope you guys enjoy your weekend.
Thanks very much.